Perfect. Okay, welcome everyone. Welcome to Reducing Barriers, the Impact of Language Access Services in Healthcare Delivery and Education. My name is Christy Moore, and I'm the Family to Family Health Information Center Program Lead and Innovative Approaches Program Manager with the Exceptional Children's Assistance Center. And I am so excited to be here today with all of these amazing presenters that we have today. We are so excited and just so grateful to be able to partner with all of these folks and bring this information to all of you. And also thank you to all of you for being here because it shows your commitment to language access. I'm going to go over just a few quick housekeeping things, and then I will turn it over to all of these fabulous people. This webinar is being recorded, and a link to the recording and the slides and a certificate of attendance will be included in a follow-up email that will be sent to everyone who attended. And this recording will also be posted on ECAC's YouTube channel. We're going to ask that people please put all of your questions in the Q&A section that's located at the bottom of the screen. And we're going to answer those at the end. So please feel free to put questions in there as you think of them. But we're going to answer those at the end just to make sure that we give our presenters enough time to get through all of their material. If you'd like to show captions, please click on the show captions icon at the bottom of your screen. And we do have a very short evaluation poll that I'm going to launch towards the end. ECAC is largely funded by grants, and we collect data on all of our activities for grant reporting purposes to make improvements and to create content that meets the needs of everyone we serve in North Carolina. And we truly, truly appreciate your feedback. All right, well, without further ado, I'm going to stop sharing and I am going to turn it over to Francisco Guzman.
Hola, buenas tardes, good afternoon, everybody. I'm Francisco Guzman, working with the North Carolina Department of Health and Human Services. It is a pleasure to see that we have people all around the nation. We have people from Texas as well. And thank you, everybody, for being here today with us. I just want to let you know that recently in October 18, we have a session totally in Spanish with families in North Carolina. It was very powerful and very helpful because they understood very well about language access. The objectives a little bit for this training that is running until 2 p.m. We will define and explain language access and analyze the role building trust and illustrate effective service delivery practices. We identify and compare Title VI, Section 1557 of the ACA and ADA, and evaluate how these laws prohibit discrimination across healthcare, education, and social services. As you remember the agenda, the North Carolina Department of Health and Human Services and ECAC and the Autism Society is doing this training for you. We will describe and demonstrate institutional duties, including assessing language needs, developing staff training, and of course, explaining and applying idea and analyze how language access ensure families with limited English proficiency can participate in IEPs meetings and early intervention decisions. Please make sure that every single question is gonna be counting today. You have the availability to do questions. We will have questions at the end of each session. And now I'm gonna pass the turn to my lovely colleague from NCDHHS, Bethany. Thank you, Bethany.
Good afternoon, everyone. So glad to be here. It's a genuine pleasure. I hope you all are enjoying October and fall, wherever you are. I'm going to have my colleague Vicki share the presentation, and then we'll get going. Awesome. So this is Language Access in Action. And I am Bethany Wagner, the manager of the Office of Language and Communication Access. You can go to the next slide, Vicki. And I'm so, like I said, so excited to be here. This is an office that's never been done before. We focus on language and communication, really all kinds of access, and we're under Division of Services for Deaf and Hard of Hearing. What we do is consult and train and provide policy and strategy guidance to elevate accessibility. You can go to the next slide, Vicki. So one of the things we want to mention today is the 4 pillars of accessibility. This is something that we've kind of come up with internally. And it's just something that we want to talk about. I'm sure all of you have heard about whole person or person-centered focus. So this is just another addition to that, another layer to that. So we like to talk about access in 4 pillars: physical, language, communication, and digital. And why we like to talk about it together is if one of these pillars were to be taken away, the house will fall. And so really we have to, whenever we're talking about language access, we have to talk about physical communication and digital access. So as we go through this, we will sprinkle that throughout the presentation and how we incorporate that. You can go to the next slide. And I'll pass it off to Vicki.
Okay, so let's begin by talking about a foundational concept for language access, which is communication autonomy. In this, under this understanding of what is autonomy in communication, we stand by the belief that each individual has the capacity to, in an encounter, to be responsible for and in control of their own communication. There is an understanding that each individual will have all necessary resources enabled to them so that they can not only access information, but make decisions based on the information that they have received. There is also the understanding that language access is not a favor that you're providing to an individual, that it is the ultimate, it shouldn't be a best practice, it should be a standard of practice. And that is something that as OLCS, the Office of Language Access, we really want to ingrain, not only within the department, but within all, especially healthcare settings. And we're going to first talk about language access within a legal scope. Language access rights laws ensure that people with limited English proficiency have the same access to services as English-speaking people. Under Title VI, and I'll go very briefly through this because we're all pretty much aware of what each legal framework entails, but Title VI protects discrimination based on national origin in federally funded programs. This includes providing meaningful access for individuals with limited English proficiency. The ADA protects language access by requiring covered entities to provide effective communication for individuals with disabilities, whether it is through the use of auxiliary aids and services. And covered entities must give individuals considerations of what is their preferred method of communication. The Affordable Care Act is a little bit more granular. Section 1557 focuses not only on the need to provide language access, but it actually defines how it's going to be done. So it requires qualified interpreters. It requires translated documentation. It defines what vital documentation is. It mandates accessibility for online content, and it sets standards for machine translation. And I will add to that verbally, it's not on the slide, but I will add a quick word on Executive Order 14244, designating English as the official language of the United States. This particular executive order does not remove the responsibility of the state of North Carolina to provide language services. So let's begin with language planning orientations, which was a framework developed by Richard Ruiz, who was a scholar and researcher in language access, specifically within the educational setting. So orientations were defined as a complex of dispositions towards language and its role, and towards languages and their role in society. And what orientations mean is that these are different ways of approaching and viewing language in society. So there are 3 orientations: language as a problem, language as a right, and language as a resource. In language as a problem, it is seen as non-dominant languages being an obstacle to social and economic mobility. And under this context, the component of language is viewed as a barrier. Then you also have language as a right. And under language as a right, you understand that you have to advocate for language access services and for people's ability to speak their native language. And this is very much aligned to what we just discussed. How is language protected within a civil rights setting? And then you have language as a resource. And under language as a resource, you can view multilingualism as a benefit and as an asset. So how can we incorporate bilingual staff or create spaces where multilingualism can coexist with the dominant language? So we have discussed the legal framework for language access, and we have discussed how we can have different orientations towards language access. I want to invite you to move a little bit beyond the compliance and the legal framework perspective to expand more on what it means to incorporate language access in the interactions we have with our patients, with our clients. And I wanted to introduce the model of patient-centered care, which places the individual's unique health needs and goals at the heart of every healthcare decision. And of course, this was developed under a healthcare setting, but it can truly be applied to a myriad of situations and contexts. In this model, patients actively collaborate with their healthcare providers, who deliver care not only from a clinical standpoint or a professional standpoint, but they also attend to the emotional, mental, spiritual, social, and financial well-being of the patient. So it not only looks at the patient and the family and the context of that particular interaction, but truly takes a step back and tries to understand other considerations such as age, ethnicity, gender, social determinants of health in order to build trust and to create a bond where decisions are made together. Under this context, interpreters are a crucial component of transferring psychosocial communication to patients and families. What do I mean by psychosocial communication? I want to introduce you to a study that was done back in 2020 that kind of got buried because of the pandemic, and it was brought back in a conference that was held on language access in Massachusetts. The name of the study is Loss of Patient-Centeredness in Interpreter-Mediated Primary Care Visits. And the study focused and presented evidence that the amount and intensity of emotional exchange is diminished as a result of interpreter mediation. So what did they do? They found that doctors expressed more statements than what was interpreted. And in the same way, patients also expressed 1.7 times more statements than what interpreters relayed. Patients and doctors engaged in more patient-centered dialogue than is interpreted, and that the level of interpreter-conveyed patient-centered dialogue was a positive predictor of patient satisfaction. So what does it mean? When I talk about psycho-emotional content, I talk about the minute and sometimes small talk that can happen between provider and patient. It's the comment about the t-shirt or the comment about my kids that can sometimes get truly lost in translation. And it doesn't happen because interpreters do not want to, on purpose, relay information or find equivalency in meaning. A lot of times it is a reflection of the current way we are approaching language access. And why I say this is because we understand that we need to be compliant. And we are often so focused in the aspect of simply exchanging information that we forget that the psycho-emotional and patient-centered approach will truly impact the way that patients walk away from interactions. I'll give you an example. I received information of a patient who had gone through a very difficult cancer diagnosis, who really walked away from her first interaction with the first person that told her that she had cancer, feeling that she needed to change a PCP, the PCP. She went through chemo, she went through radiation, then went looking for a PCP. And in the first interaction that she had, the doctor said what many doctors would say, and what many of us would want to say well-intentioned. What brought you here? And that what brought you here, and I'm sure many of you are thinking what I'm about to say, you're guessing what I'm about to say, is a doorway that opens up a whole myriad of responses. And culturally, many patients will go back to the very beginning of what truly brought them to that interaction. They'll go back to their own personal stories. And this is exactly what the patient did. The patient started talking about the first symptoms, then talk about all the trouble until the patient got diagnosed. And the interpreter stopped the interaction and said, please answer the question and get to the point. Now, the interpreter was not being mean about it. The interpreter had the opportunity to assess the different ways that she could re-engage the conversation to answer the question, but decided to narrow down the content and stop the patient and stop that interaction that included all of these very emotional content to it. So I want to invite you to rethink language access beyond the compliance and knowing how patient-centered approaches and the psycho-emotional component is such an important part of interactions. Let's rethink how we view transactional versus relational approaches. Transactional approaches will be necessary at many points, depending on context and content. So in transactional approaches, we have very short-term interactions and exchange of information, versus in relational, where we're really looking at the long-term projection of building a relationship with the patient or the client, understanding social context, going to the whole patient-centered model, and understanding what could be some of the social determinants of health that could be affecting a person's life. In the transactional approach, we are often reactive. We want to solve the interaction at the moment, and we are trying to find solutions, hoping that the patient will walk out the door with the solution that they have been looking for. And sometimes that might not be the case. Sometimes it might take for us to be proactive, making sure that the patient walks out of the room having the necessary resources. So I'll give you another example. And I saw this often as an interpreter. Patients walking out of interactions with a whole list of ideas of what they could do to change their lifestyle, to start taking insulin, without taking into consideration that the patient was not insured, that the patient had to work until 7 p.m. every day. So in the proactive approach, we are truly trying to not only solve the problem of, oh, blood work is showing that this person's A1C is highly elevated. We are trying to address the other issues that can potentially come in the way of this person's healthcare outcomes. Lastly, in transactional approaches and language access, we try to focus on specificity, while in relational approaches, we'll look for the whole context. So maybe the interpreter's approach of please get to the point was a reflection of a system that values the provider's time and is highly aware that there is limited capacity and that we need patients to truly get to the point so the doctor can go on to the next appointment. But under a relational approach, we're opening up and being more flexible to understand the full context so that we know the whole story to make appropriate decisions. So one of the approaches and frameworks that providers can take to be able to incorporate all these concepts that I've presented is to think of interactions in terms of targeted interventions. And what does it mean? And targeted interventions, especially when individuals are navigating fragmented systems of care or services, the provider has the ability to identify barriers. And I'll give you the example of Medicaid, what that looks like for individuals with limited proficiency. Identifying barriers can constitute that you can foresee that the individual has a language barrier and that they might not have access to the same type of required documentation, that the individual might have difficulties communicating. And you will try to mitigate these barriers. So whether it means that you do it yourself or that you find the resources, right, and that you specifically try to address the barriers, whether it means assisting individuals with gathering required documentation, connecting them with a social worker, with a navigator program, and also finding the tools for this individual to have, for example, digital assistants to fill out the e-pass. The third step is advocate, and I include an if necessary, and truly, if necessary, we want individuals to make their own decisions, as we reviewed on our one of our first slides. We advocate and we can request interpreted services or translated materials. We can assist in locating a DSS caseworker. And finally, our ultimate goal is to educate. We want to provide health literacy. We want individuals to feel that they can self-advocate and that they can have independence in these choices. And I'll pass it on now to Bethany.
This is Bethany. You will have these slides, so I'm going to highlight some things, but these are some kind of tips on how to work with an interpreter. So one thing I didn't mention is I am actually an ASL interpreter, American Sign Language interpreter of over 10 years, and Vicky is a medical Spanish interpreter. We have put this together based on our experience. So we want to brief the interpreter on the content. Everything you tell the interpreter is confidential. We're not going anywhere with that information. Make sure you're speaking directly to your patient or your client. That's who you're here to see. Make sure you're not screaming. So if someone's deaf, they don't need you to scream at them. Just keep it a regular tone and the interpreter will follow that. And make sure you continue to speak in first person and keep phrases short and kind of give space between sentences. Just kind of breathe and pace yourself. And these interactions will take longer. Next slide. Another thing to consider is avoiding complex jargon or acronyms, such as NCDHHS. It's okay to go ahead and say the whole thing. I'm here from North Carolina Department of Health and Human Services. Try to give as much context as possible and tell what acronyms mean and what jargon is. And if it's a complex, especially with a diagnosis, take the time to really go through each part. If you do need to ask the interpreter a question, make sure that you tell the person that is getting the interpretation services that you're about to ask the interpreter a question, and make sure clarifications are agreed out of respect. Just work with each other. The interpreter is not just for the patient that speaks a different language, they're also for you. So please feel free to utilize that service. And just to make sure, this is probably the most important one and the one I want you to remember over everything else. We are not, and I want to say that emphatically, we are not to be using children and family to be interpreting for our patients and clients. It's not okay. It could be deadly. And we should not put that burden on the family and especially children. And it still happens. It happens in deaf contexts. It happens in contexts of spoken language. And I want you to hear me say it today. It's not okay. We can't be doing that. Next slide. I'll turn it over to Vicki. Turn your sound on, Vicki.
Okay, so some considerations for spoken language. Remember that country of origin does not necessarily reflect or equate to language predominantly spoken in that region. In North Carolina, we do see more and more different linguistic communities that come to live to North Carolina. We see, for example, in Mexico, individuals that speak Tzotzil that have limited proficiency of the dominant language that for them would equate to Spanish. So it's very important to allow individuals to self-identify their preferred language. Indigenous language speakers need Indigenous language interpreters. And it may be difficult to find Indigenous language interpreters, but it is important to go through the process of trying to find a qualified interpreter who can help you relay information. Language access can truly mean the difference between life and death. And in North Carolina, we find ourselves having to respond to emergencies and natural disasters. This is particularly important for those scenarios where individuals not accessing information in their language can truly mean that, whether they will evacuate an area or they will make decisions that can severely impact their life. And consider the individual needs of each person when connecting with them to services to ensure they can access those services. So going back to what I said about understanding context instead of specificity, how are we connecting this patient or this parent to the resources that they need if the solution that I'm giving them is not applicable to the circumstances that they have? And lastly, a word on bilingual staff and bilingual helpers. It is important to acknowledge that we are bilingual and that many of us on this call are bilingual, but sometimes, and depending on the context and terminology, we may not be qualified to relay information specifically for contexts that are high registered, that have very specific professional needs, such as medical and legal contexts. So it is important that if you feel that the language is getting very technical, it is okay to say this individual has very specific language access needs and we need a qualified interpreter either for this medical context or this legal context.
Now, this may be shocking, but to this day, the deaf community still experiences language deprivation, meaning they don't have any foundational language that they can really operate from. And where that stems from is how deaf kids are educated. So deprivation is just no access to any language, right? And so professionals typically with deaf kids have encouraged spoken language or fixing a hearing and kind of focusing on hearing status instead of language, right? So we need to give kids, deaf kids, any kids really, but deaf kids is what I'm talking about right now, access to a full functional language. And the best and most readily available language to deaf kids is American Sign Language. And how that impacts you as providers is you have to understand the context. It may be that they don't understand things past a third grade level because of the way that they never got that foundational level in order to learn English after that. So there's been proof that when you give deaf children American Sign Language, they can learn any language after that, whether it's English or Spanish or whatever it may be. And if it's in another country, they would learn that sign language and then learn whatever language on top of it. So we just wanted to mention that you may be experiencing literacy issues, and it's because of a deep-seated thing that's going on in the deaf community.
This is Carolina, and I work for the Office of Minority Health and Health Disparities and the Latinx Policy and Strategy Acting Director. And we've talked a lot about the patient and provider interaction talked a lot about clinical settings, but we want to talk about the fuller context. And just a reminder that access to language services, as we mentioned, is a right, it's not a burden. So some considerations is sharing language services protocols during orientation with staff and hosting regular opportunities to discuss and troubleshoot wins and challenges when encountered. Being able to build that internal rapport within your staff, within your community even, can make a really big difference in being able to ensure that the quality of interpretation is the one that the patient deems necessary and adequate for them. Another option is to offer bilingual staff additional support, right? We talk about bilingual staff and their role, but be mindful of providing mechanisms again for quality assurance, considering including a question or signage about the quality of the language services offered. You also want to make sure that this is offered and possibly in an anonymous context or a context where the patient feels comfortable with sharing that feedback. And lean in on your community partners. I see some of the folks on this call today are community health workers. Often some of this feedback loop will come from community organizations that are supporting access to care, that are often the first to acknowledge there may be a barrier in setting up an appointment, a barrier in the way the patient was able to interact during an exchange, but there are often community orgs that are able to offer this insight, support, and feedback to improve your patient's experience. Next slide, please. So when encouraging patients to ask for help, here are some phrases that you may want to consider. You may want to consider asking, would you like to request a qualified interpreter? You may want to consider asking, these documents may be available to you in another language if you see that there's some complexity as they're filling out, especially as we mentioned. It can be a sliding scale document, it can be disclosing financial information. You as the staff can see when there may be some challenges encountered. So encouraging them and reminding them that these documents are available in another language, or inquiring whether that needs to be provided. Also letting them know if there's any additional accommodation that could have improved their visit today. And when we talk about access, we talk a lot about language access, but if you remember the pillars, there's a lot that goes into really being able to successfully come and receive the services that you need. That could be anywhere from digital access, physical access, and I'll talk more in the next slide about the whole gamut of really being able to experience and receive the adequate services in an accessible way. Next slide. So again, offering ample opportunity for support is essential in understanding and being able to provide, again, not just in terms of compliance, but in terms of really focusing on the patient and their needs. Patients' experience with gaps in language access may begin long before they even enter your practice or medical setting. There may be language access barriers when scheduling transportation to come to your practice. There also may be other areas like signage in the parking lot leading up to the clinical space that may also support a welcoming and accessible environment. We've often heard that greeters can really encourage and direct, and that even the attitude of the individuals helping them move through the space and welcome them to the space can make a difference. We've definitely heard feedback where folks, before they even enter the clinical space, are feeling really discouraged because they got lost in the building or there was no one there to direct them to the proper room or place, especially if you've got, in some situations, patients traveling around the clinical space for labs or for other parts of their just routine medical visit. Having somebody guide them or having signage, appropriate signage to guide them through these experiences can make a difference. Also, considering the format used for scheduling appointments, there may be, it may be that the phone line doesn't offer an ample opportunity to really receive the language services in the way that folks may truly need it. And then of course we know that there are resources like I Speak cards or language lists that can also be incorporated to really ensure that the patient is receiving the care that they need. Next slide. So I'm just going to quickly walk us through some risk areas that may be encountered. Oftentimes, there may not be an interpreter line, or the interpreter line may be down or delayed. Often, leaving us to rely on family and friends to interpret. We've talked about just the fine line there and some of the complexities of using that as a resource. Also, the non-translation of vital documents can be a risk area, the lack of staff training, often not having data monitoring or assessment of language, limited English proficiency services and disability access. And very often there's an absence of a grievance or discrimination and complaint process made visible to the patient. Other consequences also include patients not being able to fully understand their diagnosis, their treatment, and potential risk for discrimination claims, reputational and financial risk. So all in all, when a patient arrives, sometimes staff may, this is just an example, staff may scramble for interpretation. There may be no translating consent, no signage. The patient may receive delayed appointments or minimal explanation, and this is obviously a risk for a possible complaint. Next slide. I believe this is you, Bethany.
Bethany. So one thing we would really like to see, just from my experience as an American Sign Language interpreter, I've had providers come to me and say, like, I know I just had an interaction and that interaction was not up to par with what I was trying to communicate to my patient. The interpreter just wasn't up to par. And I wish I could tell someone about that. And I hear the same from patients. Like I had an interpreter the other day. It was awful. I know that they did not tell the provider what I was trying to tell them. So we would really encourage, it doesn't matter where you are, to develop a feedback loop where not using the interpreter of the situation, but like a survey where the provider and the patient can fill out a survey about how the interpretation went, just to make sure that both sides are getting what they need. Again, the interpreter is for the provider and the patient. It's for both parties. So we want to make sure that the interpreters that are being provided are up to caliber. And so it's just something that also can create trust, is that if you as a provider are willing to make sure that the quality of the interpreter is good. And before Vicki comes on, I'm going to talk just at the bottom right here, it talks about American Sign Language certification. So when you're looking at interpreters, you need to see that they are either RID, and that's the national certification, or there is a test out of Texas, which is BEI. So I think our Texas folks might be familiar with that. But these are two certifications. Some other states accept different certifications, but when it comes to North Carolina, these are the two that you're looking for. And when you're talking about medical stuff, it needs to be a fully licensed interpreter. So North Carolina has licensure for their ASL interpreter. So you want a fully certified interpreter when you have your interactions. And I'll let Vicki talk about the medical interpreting certifications for spoken language.
So for spoken language, we have two main certifying bodies in the United States. It's the Certification Commission for Healthcare Interpreters. The credentials are the Core CHI, which is a general spoken language, and CHI, which is more directed towards highly used specific languages such as Spanish and Mandarin. We also have the National Board of Certification for Medical Interpreters, which offers a CMI or the Hub CMI. It is very important to take into account that these certifications, though they have core requirements of 40 hours of training, education, it really depends on each interpreter and the trajectory that they have built. So the more you're exposed to the field, the more you will build your skill set. And one of the areas, going back to what Bethany was mentioning about how we often hear feedback on, well, this interpreter and this interaction didn't interpret correctly, or I still feel like the doctor didn't really understand what I was trying to explain. One of the issues that we're encountering now is that there are many interpreters that are hired and they work from abroad. So they might not have the regional understanding of what services are provided, or even certain terminology that we use in the United States. And this is often a reason why a lot of patients might walk out feeling that the interaction didn't go as well as they would have wished. And it's also important to provide that feedback to LSPs, to language service providers, because through that feedback, we will be able to make an impact in the way that they hire and that they screen for medical interpreters. And lastly is you're not alone. Please contact us. We'll be happy to discuss any particular concerns. So, or if you want support or further training, we do, together with Language Access, we also focus on cultural competency. We didn't talk about it at length. We talked about some components of it, but it is one of the areas as well that we work with, because we believe that language access goes hand in hand with the way that we approach culture. And I'll leave a few minutes for Carolina and Bethany to say your last few words.
Thank you, Vicki and Bethany. Just a reminder, and I hope that you find this presentation not only informational, but also encouraging. You are definitely not alone. There are a lot of processes for setting up successful, accessible access to language services, and we understand that. And so we're here to walk through any scenario. We often field a lot of questions from community health workers or even the community on how to access some of these services, or particular instances where a complaint wasn't filed, or they didn't know that that process existed. So we are in a great place to support you all as providers, and also at a great place to hear from community and really be able to leverage that trust and that input to improve your services. So with that, thank you all, and I'll pass it on to Bethany.
Thank you so much, everyone, for just having us. And like you said, don't walk alone. We're here for you. We love our jobs. So please reach out. I put our emails in the chat, and we're here for you. Thank you so much.
Thank you, all of you. This is Milly Ramos. I will start with my presentation. I'm going to share my screen. One moment, please. Can my screen be seen now? If someone can let me know in the chat.
Yes, we can see it.
Okay, thank you. And okay, thank you so much for being here. I'm Milly Ramos. I'm the bilingual parent educator for ECAC, the Exceptional Children Assistance Center, and I'm going to present in reference of the Department of Education, Special Education, Early Intervention. I hope that everybody is feeling good today, as I wish for everyone. Thank you for being here. I do really appreciate this opportunity and all of you taking this time. So welcome, welcome, welcome. I would like to know a little bit more about all of you that are here with us today. So if you can let us know if you are a case manager, a teacher, a provider, on the chat, that would be great. And my name, as I say, is Milly Ramos. I'm the mother of a young adult that has autism and moderate intellectual disability. And Joseph is my reason of why I am so committed to serving this community. So let's start with the presentation. the objectives today for this presentation is to learn about rights in education, early intervention, and special education services. So we are going to be talking about what language access is under Title VI, rights for the families to access interpreters and materials in their native language, and information on requirements and performance that an interpreter must demonstrate in these areas of education. So what is Title VI law? When we talk about Title VI in language access, we are referring to the Civil Rights Act of 1964, which prohibits discrimination on the basis of race, color, or national origin in any program or activity that receives federal funds. The Supreme Court and the Department of Education have interpreted denying language access to students who are not proficient in English to constitute discrimination on the basis of national origin. That's why schools must provide support services such as English as a second language programs, interpreters, or translation, so that students and their families have equitable access to education. So, how does this Title VI law relate to language access? What does it mean for families who are not proficient in English? Families cannot be denied language support services because it might be considered discrimination on the basis of national origin. Schools and agencies have an obligation to ensure that families with limited English proficiency, LEP, can fully participate. It is important to clarify that Title VI of the Civil Rights of 1964 applies to any program or activity that receives federal financial assistance. Title VI prohibits discrimination, remember, based on race, color, or national origin, because national origin includes language. Recipients of federal funds must ensure meaningful access for individuals with limited English proficiency, which typically includes providing qualified interpreters and, when appropriate, translate materials. Agencies that must comply include federal departments and the state, local, and private entities they fund. For example, the DHS and state or Department of Education. They must follow Title VI language access requirement and among other local agencies in the state. Okay, let's see what is a person with limited English proficiency. Because it's important to know the acronym LEP stands for person with limited English proficiency. That stand for these people or this individual whose primary language is not English and have the limitation for the ability to read, write, speak, or understand English well enough to participate fully in a program or a service. So recognizing who is a LEP or LEP individual, the 4-factor analysis on the LEP guidance are: agencies and schools that receive federal funds must evaluate language access. Language access needs using these 4 factors: number or proportion of LEP persons served or eligible to be served, frequency of contact with LEP persons, nature and importance of the program, activity or service, resources available, and cost without using cost as a reason to avoid meaningful access. Identifying LEP individuals, Recipient must identify people who are not sufficiently proficient in English to participate fully. Common methods include home language survey during school enrollment, parent-guardian language forms indicating the primary home language, observation and screening assessment of the student's English proficiency. Example, placement test. School obligations. In the education context, schools and districts that receive federal funds must provide meaningful access for LEP students and families, which includes instructional services such as ESL, ELL, programs to develop English proficiency. Language access for parents, guardians, interpreters, and translated essential documents so they can understand meetings and decisions. Example, like in the IEP meetings, discipline placement, academics progress, etc. And we'll touch that a little bit more later. So, therefore, how the 4 factors will determine when translation interpretation is needed. Does the program receive federal funds? That's the first questions that we need to ask. Is the person limited English proficiency? And they need the information in their native language to make informed decisions? Is this service provided by an agency that required to comply with the Title VI? What are the consequences if the language access is not provided for the person and for the agency? These are questions that can help to determine if this person is a LEP person. What about the Department of Education? Well, let's review education, which is the one that I am presenting today. Schools must provide information to parents with limited English proficiency in a language they can understand to inform them of any program, services, or activities that are interested to parents with English proficiency. Even if the child is fluent in English and or the family is fluent in English to some extent. So, and what about specifically special education? In the context of special education, IDEA or IDEA refers to the Individuals with Disabilities Education Act. It's a U.S. federal law that guarantees free, appropriate public education for children with disabilities. So IDEA is this federal laws that set standards and guidelines for states and schools to provide special education and related services to children with disabilities. IDEA protects the right of children with disabilities who qualify for special education and the rights of the parents by ensuring a free, appropriate public education. So, what it says on IDEA? Then, IDEA is a federal law that authorizes special education for the children with disabilities in the United States, the whole nation. It also authorizes the early intervention services that states provide to our infants and toddlers with disabilities through their 3rd birthday. IDEA stands for the Individuals with Disabilities Education Act. In Spanish, it is called La Ley de Educación para los Individuos con Discapacidades. And more than 6 million children with disabilities who are eligible receive these services under IDEA. What are the rights of families under IDEA? Well, access to oral interpretation at important meetings and communication, translation of essential documents, like, for example, IEPs, progress report, consent forms, and equal access to educational programs and school services. A qualified interpreter in special education is someone who can interpret effectively accurately and impartially using the specialized vocabulary of IDEA. And the school procedures and who follows professional standards. Core competencies, knowledge on IDEA and special education process, like the IEP, IFSP, evaluations, eligibility, services, placement, progress, monitoring, dispute resolution, etc., etc. Specialized terminology in IDEA. It's about the disability categories, assessment, accommodations, modifications, related services, MTSS, RTI, FAPE, LRE, ESY, etc. Also know about the parent guardian rights. Notice and consent, access to records, participation, language access, due process, ethics and confidentiality, impartiality, role boundaries, FERPA, confidentiality, mode and skill, consecutive site translation of essential documents, accurate note-taking, and memory skills. Cultural and linguistic competence renders meaning without adding, omitting, or substituting, checks for understanding school policies and implementation, understand district state procedures, timelines, and meeting protocols, training, qualification, evidence, documented training in educational interpreting, assessment, or certification where applicable. Like it was mentioned before in the previous presentation, RID, ASL, local district qualification for spoken languages, ongoing professional development, meaning that a qualified interpreter is not just someone who is bilingual, but is competent to interpret in special education based on all these requirements, vocabulary, and competency. Then there is the Title VI of the Civil Rights Act applies alongside IDEA and the North Carolina's policies governing services for children with disabilities. Together, they require school districts and agencies that receive federal funds in North Carolina to ensure meaningful language access for families with limited English proficiency, LEP. This includes providing a qualified, competent interpreter and, when appropriate, translations of essential documents so parents can participate fully in special education decisions. So, in special education, parents must receive a prior written notice in their native language. This is a summary of the meeting, the IEP meeting specifically, unless it is clearly not feasible. In some times, maybe this family speak another language that is not feasible to provide that interpreter. Like, for example, there's some Hispanic families, they come from these Hispanic countries that they speak a dialect. So if it's not possible to find a person who can speak that dialect, the school should be provide a person who can maybe utilize Spanish as a language for them to access the information the best we can. We know that some individuals, LEP individuals that speak dialect from Hispanic countries, they might understand at some point Spanish. So it is not feasible to provide a dialect interpreter, but the school has the responsibility to provide a language that the person will be available to understand. So language access is not limited to spoken language interpreting. School must provide qualified interpreters, including sign language for people who are deaf or hard of hearing. And also accessible formats such as Braille, large print, or accessible digital format for people who are blind or have low vision. These supports ensure that individuals with limited English proficiency and individuals with disabilities receive the access for the language. Okay, during evaluations, under IDEA and Part B, which is special education, evaluations may be conducted in Spanish for those students. And it should be a competent interpreter who also understands the family's cultural context. Remember, not all Hispanic families share the same vocabulary or custom, and the same principle applies to any other minority group. What it says under Part B services, the IEP, which is the program for special education for that student, is developed at an IEP meeting that you must, under IDEA, section 1614, be invited to attend along with certain school personnel. The school should make sure the parents understand what is happening at the IEP team meeting, including arranging an interpreter for the parents if they are not fluent in English if they are deaf or hard of hearing. So all this, it's stating on the IDEA and on the policies for children, North Carolina policies governing children, governing services for children with disability. So it is important that the interpreter can comply with the requirements. So services provided by the Department of Health and Human Services are health benefits like food assistance, services for people with disabilities, and early intervention services for children from 0 to 3, among other services. So for all these services, if the person is left, doesn't have the proficiency in the English language, the information should be provided in a way that they can understand. Let's talk about Part C services. All direct services of the Infant and Child Program, ITP, are provided in the family's native language according to the 4 factors that we mentioned before. These include the initial referral contact, the evaluation, and the AIFSP meetings. Okay, serving families under Part C Early Intervention Program have also the responsibility to comply with the 4 factors mentioned previously, taking in consideration for the family to understand to what they are providing consent, the rights for the family and child. Make sure that the child is evaluated in their native language so the evaluation results are accurate and precise. And finally, for the family to understand the IFSP, which is the plan for that child, and the family is part of that plan as well. In other words, it's a plan to help the child to make progress. So early intervention services may have a transition to school to special education services. However, due to the young age of the child, this transition is carried out with the preschool program. It is important to be informed and trained to navigate the special education system. Even in this whole process, the parents have the right to have a competent interpreter. At all times, when the parent, the family is transitioning that child to the Department of Education, it is important to provide this interpretation for them so they can understand the whole process, and possibly they will have too many questions. So in summary, these entities must provide interpretation and translation services to parents and legal guardians who do not speak English or another language other than the school's language. Interpreters and translators must be proficient in both languages and have knowledge of specialized terms and concepts used in special education. The provision of interpretation and translation services should not affect parents' participation on IEPs, IFSP, or other special education-related meetings. Parents have the right to request interpretation and translation services at no cost for them. So, what are the important key points? Parents should fully understand all information, and anything communicated should be accurately translated to ensure clear understanding for everyone involved. Parents must understand the available options to make an informed decision, which means being aware of the consequences of each choice. When parents understand the information, options, and consequences, they can consent to or authorize services and make meaningful decisions. So when these steps are achieved, parents can have an active and meaningful participation in these meetings and in the services that are provided to the child. Okay, the interpretation and translation should have integral part of a language access plan. Interpretation could be oral, writing, sign language, or braille. An interpreter is a person that is capable of transmitting given information from one language to another, including the same registered implicit information and emotion used in the original message. Interpreter standards. They must have knowledge and vocabulary of the terms, concepts, and program for which they are providing the service in both languages. Be trained in the role of interpreter or translator, including ethics of interpretation and translation, and also comply with the obligation to maintain confidentiality. So being bilingual is not the same as being an interpreter. So before anyone provides bilingual or interpretation services, it should be required linguistic and cultural competence. That means more than being bilingual. Agencies must take reasonable steps to evaluate and certify interpreters and staff who identify as bilingual to ensure, first, proficiency in both English and the other language, speaking, listening, reading, and writing. Second, the ability to interpret accurately, effectively, and impartially, including proper use of consecutive, simultaneous, and side translation. Third, knowledge of specialized terminology relevant to the setting. Also, look for ethic and confidentiality, strong cultural competence, and an understanding of the laws and policies that drive language access, like Title VI, IDEA, Section 504, ADA, and finally, is required to have training to review or to check if they need to have a training to be an interpreter in that specific area. So these are characteristics of a competent interpreter. The interpreter can communicate fluently and effectively in both English and the individual's primary language. The interpreter can interpret truthfully and impartially in both, and the interpreter has an understanding of the specialized terms and concepts frequently used in the provision of local authority services. Also, should demonstrate cultural competence, understand the obligation to maintain confidentiality, and understand the roles of interpreters and the ethics associated with being an interpreter. On this slide, we will have resources that you are going to receive a copy of this so you can review any information on the webpage that we have go to get all this information to make this presentation available to you. So please place your questions in the Q&A if you have any. And we really appreciate that you have been here today with us. So muchas gracias. Thank you, everybody, for being here today. I will pass then the presentation to the next person. And I will stop sharing. Now, we have Mariela Maldonado from the Autism Society of North Carolina to present with us as well today. Thank you.
Hi, Mariella. Are you ready to come on? Okay, well, Mariella might be having some technical difficulties. So what I did want to do is we have had a couple of really good questions in the Q&A. And I know that the answers were typed, but I did want to read them out loud because they're really good questions. And I think that everybody could benefit from hearing the answer. So one of those questions, oh, Mariella, are you ready now? I don't want to jump into questions if you're ready. Mariella, are you ready?
Hello, good morning. Yes, I'm ready. I am
Okay.
to share my screen.
Okay, perfect.
Okay. Okay, good afternoon. Thank you for inviting Autism Society of North Carolina to talk about the topic about the Hispanic culture and autism. My name is Mariela Maldonado. I am the Senior Hispanic Outreach and Support Coordinator. We're going to talk about how we can understand how cultures influences parents in seeking diagnosis and making decisions about the treatment and services, how we can build strategies to better help and work with the families with a culture different from our own, and also understand how to bridge cultural differences and build trust to families and clients. So we would like to share first about what is Autism Society of North Carolina. This is a nonprofit organization that improves the life of individuals with autism, support their families, and educate communities through the lifespan. We support families with autism resource specialists in English and Spanish. Also, we have in another language as well. workshops and conference in Spanish, translated also documents in Spanish. We have webinars as well, support groups, summer programs, adult programs like Ignite, and also employment services. We provide educations. We have a representative at the public policy advocacy, awareness campaigns, trainings for professionals in order that participate in Contact Autism Society. The child needs to have autism. Anyone can refer us. There is no need to have a referral only from the pediatric. Anybody can refer a person. The same parent also can refer themselves, and also teachers, members of the family, members of the church. Anybody can refer to us. We're happy to contact the family. Also, all the services are free, but also we provide services as ABA therapies, one-to-one persons. We provide also evaluations for children with autism, but this is with the Medicaid and other private insurance, but the majority of our services is free. Okay, so we would like to understand a little bit the diversity of Hispanic Latino culture. Some characteristics that we're going to mention today really do not apply for the whole Hispanic families equally. There are some misunderstandings about speaking Spanish that led to the interpretation that Hispanic families, because they have the same beliefs and ways of living, but like any human being, any person has different ways to view everything, either belong to the same culture. Each family has a Hispanic influences according to the dynamic of the lifestyle, time of the living in the United States, education in their country or United States, age, economic situations, and another influences like any human being. So, for example, a family who grew up here in the United States but is still Hispanic is going to have a different kind of impact for a family who came here around 30, 40, or 50 years old and living in the United States, and they have a child with autism. The influences of the Hispanic will change of the ages, the time living out of the country, the way that they have been raised. So different situations. That's important to say that everything that we're going to share today doesn't mean it's going to happen in any Hispanic family or Latino family in Carolina or United States. So we're going to talk about what is the family. The family of public life. For example, Hispanic identify strongly with I'm going to continue. Can you hear me okay?
Yes, we can hear you.
Okay, something happened, but are we okay right now? Yes, right? Okay. So I was saying that some families are very strong to the family, to respect and preserve cultures. It means, for example, when you are going to provide the result of the evaluations or something like that, and you would like to say the child needs to go to the school because here in the United States, from 3 years old until 5 years old, they can go to the pre-K classes, especially who has anybody diagnosis with autism. And some parents, they say, no, it's too much. My child's supposed to be with me or something like that. I believe it's too young. I believe that the child needs to stay with the mom because it's too early to go to the school. This is something they believe for any reason, maybe cultural, because they believe children be with the parents until they're going to be a time for the school around 5, 6 years old. This is something that we need to respect because they believe, or maybe they're going to take care of these informations and talk to the mom who lives in the country or the grandparent, or maybe the older brother to say, what do you think? My child supposed to go to the school right now at 3 years old, or we should wait until 5, like that. So this is the way that sometimes the dynamic of the culture Hispanic is working. They would like to respect their beliefs and talk to the person in charge, not in charge, but the person who guide the family, which normally is the parents, grandparents, or the older brother. So what we can do is we can listen to the families, believe in whatever they feels or the fears, expectations, without adjustment, because this is the way. There is no way we're going to change the culture of the beliefs. We can educate them, and each parent has the right to say, yes, I'm going to take my son to the school, or I'm going to wait. Another thing that happens in the Hispanic culture is machismo. The machismo, you hear about the machismo, doesn't matter. It doesn't mean it happens only to the Hispanic culture, but something is present in some way, the Hispanic culture. Machismo, the husband may not accept the diagnosis, the training, or maybe would like not participate in any training or medical appointments because they believe, sometimes, no, it doesn't mean it's happening, but sometimes believe the mother is in charge for the education, or the mother is not paying attention to the child, and this is the reason this child is not talking or not paying attention or not following indication. So what we can do, we can provide and accept information, but we can provide ideas, information, resources, and also we can check if maybe the husband or the father of the child could participate in any meeting, or maybe can participate in any webinars or workshop to educate himself about this information about autism. Also, elderly families members sometimes run the families, as I said. In some cases, I can hear families saying, I need to talk to my grandparent because they are helping us to came here from my country to here. I'm the third generation, so they would like so much to be part of the life of my child. So I need to talk to them and check if my child needs to go to the school, or we need to wait, or if my child can need to be in any therapies, or if I are allowed to bring any therapist to my home, because this is something that I don't want to break any rule from my family. So what we can do, we can provide resources for the training, also invite the grandparents or the older brother or anybody who is in guided family to participate in any webinars, consultations, and everything. Okay. See here. So we're going to talk about the linguistic families. Sometimes they may perceive any kind of disrespect when they call somebody for the first name. So I hear here in the United States, sometimes you can talk to the family and say, hey, Mariela, gracias, or Mariela, thank you to bring your child. But sometimes for Latino families or Hispanic families, calling by their first name is disrespect in some case. But it's important to say that in Hispanic culture, there are different ways to contact or to address anybody. For example, the informal way is when you call the person with the first name, like Maria, Juana, Pedro, etc. Because this situation is when the family is or this person is a member of the family, right? For example, it's a friend or a close friend, like that. Okay, Maria, ven para acá, or Maria, come here, like that, because this is the way. But normally you address a person that you don't know, which will be a teacher, or could be a doctor, or could be a therapist, by something that you can show any respect. Like, for example, say, Mrs. Johnson is a teacher. Mrs. Johnson, this is my son. Can I talk to you? So most of the parents, they don't say, hey, Doris, this is my son, or whatever. So they're going to have a respect. This is the way also the Hispanic families are waiting that they can be called by the first name, or Miss Maria, or Miss Rosario, or maybe by last name, Mrs. Gonzalez, or Mr. Perez, like that. This is the way that could show some kind of respect, because anybody can have a good intentions to talk to somebody, but you call for the first name, maybe it can impact to the family, especially when it's the first time that they're going to contact the teacher or the doctors or the nurses or the therapists. And also translate the communication in documents in informal way. I saw so many invitations and for webinars or presentations. Say, hey, come here to this presentation, but they're using in a formal way, like, Si tú estás preparada para esto, ven a esta reunión. So normally we don't know this person. We can show you respect in our invitations. Usted, like is the third person, say you as a man, you can come here. You are welcome to come here. Any parents, but you showing by respect like that. So this is the language, the way that people can understand, or the Hispanic population can receive better information that you're going to share. And the dynamic about the linguistic is the same. Having an accent when somebody speaks English does not necessarily means that they need or they have any language barrier or this is low educations or like that. For example, somebody goes to the appointment, you're a doctor or you're a therapist or you're a social worker, and they're talking to you in like that with accent, like the way that I am right now. I have an accent of course. It doesn't mean this person does not speak English, or it doesn't mean this person, they don't know what happened or they don't understand what happened. So it's very important listen the person before to decide if this person is going to have a translation. We can listen and say, we can say also, we here in these places, we provide translations. Let me know if you are comfortable to have an interpreter, but I understand in you, but if you need, we can call like that. So instead to say, hey, just a moment, hey, an interpreter here. So we can have like this kind of respect, waiting until the person is going to request an interpreter in case this person needed. But in case this person is still talking, and maybe you don't understand this, I'm so sorry. I appreciate so much you talking to me, and I believe that you speak English, but sometimes in some way I'm not able to understand you, and I don't want to miss what are you going to talk to me. So is that okay if I call the interpreter? It's not going to be for you, it's going to be for me, like that. So in this way, this person is going to receive this information in a different way to say, okay, you don't speak English, I need to talk to an interpreter. So there are different ways how you communicate, and you can have successful interactions with your client, right? And also, talking with in Spanish or in meeting, requesting an interpretation, it doesn't mean this family is undocumented. It doesn't bad. I want to say it's not bad to have documents. I'm saying sometimes we can say, okay, so you don't have documents, right? We cannot provide service. But this person didn't say nothing. Didn't say I need or what can I do? I'm not eligible for something. So wait until the person is going to request, explain you the situations instead to assume this person does not have the legal documents to get the services that you are offering, right? So most Hispanic also, they have more than one name. Like for example, in my case, my name is Mariela Luz. And I have two last names, which is Maldonado Ramon, which is my father's last name and my mother's last name. So in this case, it's important also to show respect when somebody is telling you, okay, what is your name? My name is Maria Guadalupe Rosario Perez Aguilar. Sometimes it's very difficult to hear someone say, oh my God, how many names, how many last names, how can you do it like that? So it's important also to show any respect, whatever the name is, because either it's a name in Spanish or English, somebody say, well, a difficult last name, it's important to don't mention, or it's important to show respect without making any comments about how long or how large or how many names they have for the first name, how many last name they have as a last name, something like that. So, and also so many names are difficult to pronounce in English, and also for anybody who speaks English. So we can also respect to say, could you please spell your name for me? In case this person says something that you don't understand. And to say, oh my God, stop. I cannot write your name. Please, you need to spell your name. So something like that. So there is a ways that you can communicate, and probably you're right because you don't want to hear more, but it's important also showing respect, saying, okay, I'm going to spell your, please spell for me, because this is the way I going to make sure I'm not going to make any mistakes, something like that. Okay, so one other thing is also influence is religion and cultural beliefs. In the Hispanic culture, religion is very strong influences for the Hispanic culture as a part of the integration of the community. So most of the time, parents who are coming from different countries for the first time here in North Carolina or another states, the first step is go to the church. Whatever the reason, could say, maybe we'll say to say thank you, I'm okay here, thank you God, or any belief they have, and also for the same time, because this is a place that most of the Spanish speaking parents or community are there, and they can be integrated for that. So very important. If we know that these families are participating, or maybe we can ask the questions, we can also invite people who are in the religion to participate in the meetings, or also we can say, do you want me to provide information for your church or something like that? And also it's very important to provide resources, by the way, in the Latino communities of faith or community faith Latinos, to provide information what we are going to offer as a professionals, no? Sometimes difficult behaviors for children prevent parents to participate in the Hispanic ritual celebrations, because sometimes they need to concentrate. So sometimes it's difficult. So in some way, if we can really help them to find ways that the church can provide, for example, any kind of childcare, or maybe they can have a space where the families still attend the services for their beliefs. Maybe they can have a small room where they can stay until, and they can hear the presentation by any kind of ways, and maybe the children can be taken care for another people. There are different ways. So somebody at this time, I don't know who's participating as a professional, but anyway, you have any connections with any organizations of faith, will be churches, institutions like that, it's a good idea to talk to them. Say there are parents that have children with autism or with another conditions, that they would love to have anybody who really can take care of the children or help them in order they can participate. Other way they're going to be isolated. So religion may influence in the ways of view. Sometimes they can believe that the autism and another condition is like kind of punishing because something they did something in the past, or maybe they didn't follow support. So whatever somebody say, I believe that my son has autism because I never go to the church, or I never follow my parents' beliefs, something like that. There is we can listen to them. We cannot judge them, of course, but we can listen to them, and maybe we can invite them to say, go to the church, talk to somebody, or invite in the next meeting your pastor or somebody of your church. You would like, they can know about what happened in your life, and you really can find the resources that you're looking for. Right? As some families believe also the autism is caused by courses, and also because something is very something bad, spiritus, bad situations, and they need to be a cleaning. So I hear so many parents say, oh, I believe my son has autism because in the past I have these situations, and they give me some kind of course in my life, and so I need to go to somebody who's going to clean my son, somebody who's going to clean me. So our in the way that we can receive this information, we can listen to them instead to say, don't believe, it's not like that, and something like that. Something is much better to listen to them, because this is the way that they believe, right? And also, they would like to get more information about what happened with autism that is not related about that. You can share. Look, there are here some information in Spanish about explain what is the reason of autism or something like that, instead to really try to teach them that this has nothing to do with the really religion or cultural beliefs. So also, I can hear the parents are bringing the children from different people who specialize for cleaning. So somebody listen to us. So everybody has different ways to react. They can say, they can listen, and also they can say, here is the document show you how is the training here in the United States or in this hospital, and you make decisions. Thank you so much. So thank you for sharing with me, because there is nothing we can change whatever they thinking is going to happen, right? So for some families, understanding autism and learning how to navigate the service is a huge challenge, because most of the time, not all of them, some Latino families live in small towns, small places. Not all of them, but some of them, where the doctors, the nurses, and the training for this kind of is not happening, or maybe somebody is coming for any specialty after 1 or twice a year. So you understand. So sometimes there are so many children or adults in this town, they have different kind of diagnosis. They don't have any training because they don't understand the parents. So for them, it's very difficult to understand what I need to do. So maybe they give me, I have the situations, I need to deal with them. This is my responsibility. They don't bring the children for the school because they're embarrassed, or maybe because they believe nobody's going to help them. So different kind of things. So we can listen to them, but also we can provide at the same time resources. Say, this is the school. In the school we have children. They have diapers. The children that they cannot go to the bathroom yet because they need to work in this kind of programs to learn how to go to the bathroom. Some of the children, they are not talking yet. They are 5, 10, 15, 17, and they cannot talk yet because the diagnosis of autism or another diagnosis, right? So they may understand that the schools, the programs, the therapies, they can manage different kind of services here in the United States. Probably in their country, there is no services, but here there are services, so we can teach them in the way that they can really learn. And they say, if you are not sure your child is going to go to the school because too young, or you believe somebody is going to, is not going to help them because they cannot talk, maybe you can request to the school to have a tour, or maybe you can talk to another parents that have a child with autism and talk to these parents. Say, do you have a child with autism? How is like that? So in Autism Society of North Carolina, we have Hispanic support groups, and these groups are very important for the parents to talk what happened in the school, or what therapies if the another mom is receiving, or if somebody is going to the home, what is the situation. So this is very, very interesting how the Hispanic support groups are really helping parents to understand what happened around the other parents with the schools, with the training, therapy, service programs, and everything. So also, they have this kind of feeling that if the child has a behavior that can be rejected, and they feel, I cannot go to this party because my son is going to scream, or I cannot go to the church because it's moving so fast, or I cannot go to the park because anybody is pointing me or is looking at me, and I feel so really they're rejecting me because I have a child with different needs. So there are places that really happens. So parents can still go and advocate for the children and bringing the child to the park. If the child is screaming in the park, this is the way of the child. It's going to be like that, but there is no reason that they need to keep in the home, because this is the way that they behave in the community. The problem is when the child is hitting or breaking things, or hitting another child, or pulling the hair. This is different. But if somebody, any child is jumping, making a run, running, coming back, or singing, this is part of the life. So it depends. So we can still teaching the parents, teaching that everybody has different ways of react. So in any places for anybody, unless there is something in danger, or something like hitting or throwing rocks or like that, it's different. But it's something about behavior and jumping and come back, is getting up and sit down like that. So it's a different situations, no? So really, sometimes parents also, they don't know how to start, what we can do, what is next. They just gave me 30 numbers. Where can I start? So our job could be to educate them, to say the first step, will be something in the school. Let's go to the school. This is the number of the school. If you don't know where is the school or what is the next, please call Autism Society of North Carolina, and we're going to be so happy to provide informations to the person who's contact us, and also they can refer to us. We have forms that refer to Autism Society. We can contact the parents, we can educate the parents, and also we can educate the professional. Anything, it will be referred to the school, or maybe get a therapist for behavior called ABA, or contact the MCO, which is the local, which is the organizations care managing, so that means that the organization who manage the care for somebody who needs care. So it's very important to contact any of these offices, and this I'm going to share my information and my phone number if you would like to refer the family for autism to Autism Society. Either the child does not have autism, we can refer to us also, but also today we have great presenters, and they have also great experience working with children with different disabilities. No, it's how we can overcome barriers in these situations, right? So we can provide services in Spanish. This is possible. Right now, there are so many organizations that can provide services, but they only have a few bilingual, or maybe they can have, for example, they provide information for the whole state, but they have only 3 people for the whole state in Spanish. So if we can really, our professionals who are working, or companies who are participating today, we encourage them to try to have bilingual person, or maybe hire interpretation because today we talk a lot about the importance for the interpretations for families, no? Also, we would like so much that we can help us to increase the awareness of autism in different ways. It will be great that we can have a picture in your place saying autism is beautiful, or any kind of sign that people can go to the restaurant, or can go to the doctor's appointment, or can go to the therapist. They feel acceptance. They don't feel like, oh my gosh, another problem. No, we would like to see how the professionals, how the providers are getting families, but also at the same time educating them, and also accepting parents and individuals with autism. Right? So what about if some professionals, they would like to have informations, but they don't know how to work with them? Please refer to Autism Society. We have different kind of presentation for professionals, for parents, for teachers, for doctors, for pediatrics. We have different kind of education about autism in English and Spanish, no? And also, if we can help them to refer families in case they need any financial resources, we have a list of the Hispanic financial places for food, to paying electricity, utilities, either also for any situation with the rental places. So please refer to Autism Society or another organizations in case they need any kind of help. So it's in ULICE also, there are right now situations about the immigration status. They can please refer to North Carolina Legal Aid, who provide support for families. They need or they're looking for kind of help for immigration status. And also so many churches across the state, they have a bilingual person, or sometimes a non-profit organization like a Hispanic Center. They have their own paralegal who provide services or information about how to help in this situation. So this is our resources in Spanish. You can see this is our Spanish resources. They have different pages, starting with what is autism, what are the resources available, and also the list of the Hispanic support groups, and the list of the Hispanic events that we're providing. So this is the kind of informations, like any kind of sign that you would like to have in your place. We would love to send to you, or you can create something saying inclusion for children with autism, or any other word like autism is beautiful, or we love somebody who has autism, something like that. So we're talking about the importance that translate programs in Spanish to provide opportunities for families who are looking services in your place. We would like so much it is possible to hire bilingual staff or volunteers or interpreters, so parents can really have the opportunity to talk. And in case you already have a person who speaks Spanish, or also you have already interpreters, you can say in your sign, se habla español, so we speak Spanish. So people say, oh, this place they speak Spanish, so I'm going to contact you, something like that. So it is important about understanding the culture, increasing all your staff, the knowledge about the Hispanic culture. Is anyone who's present today and have registered for this presentation are interested? I talk to your organization or your company. We would like to talk more about that, how to understand the Hispanic culture. Also, we have videos, and right now there are so many technology that has increased the communication with Latino families. Autism Society has a Facebook, WhatsApp, Teams, and another. You would like so much to increase your way of communication with this kind of mass media will be great, by WhatsApp, by Twitter, by Facebook. There are so many families that they have knowledge about how to use this media. Mass media also will provide informations about in the newsletter in Spanish, and also magazines in Spanish, TV, radio station in Spanish are the good mass media for you guys to promote and talk to the families as well. So this is my name. Again, Mariela Maldonado, Senior of Hispanic Origin Support Coordinator. This is my email, which is my first name of my first name, M, and then my last name, Maldonado, at autismsociety-nc.org. And this is the Spanish line, which is 919-865-5066. This is the t-shirt that we are offering anybody who would like to contribute to the Hispanic department. If you would like to have any events, and you would like to have everybody can wear t-shirts in Spanish saying, I love autism. I love so much this t-shirt that we created a long time ago. They said autism is logic, unique, very authentic, creative, independent, incredible, smart, perseverance, innovator, smart, beautiful, strong, like that. So I love so much this t-shirt. So we have different sizes, but one color is gray, dark gray. In case you would like to contribute in any way, or you would like to give somebody a Christmas gift like that, please contact us and we can send to you by email. Thank you so much. So if you would like to some questions, let me know, but it's very, very a pleasure for me to talk to professionals to understand how to work with Hispanic and Latino families. Thank you so much, Chris. Appreciate.
Thank you so much, Mariela and Millie and Carolina and Francisco and Victoria and Bethany, everybody. I was going to read a couple of questions that was put in the Q&A, but I think Victoria answered. I don't know if y'all noticed, but I got kicked out for a few minutes. And when I came back in, I can't see the Q&A anymore. So Victoria, can you read? There was two questions that you had great answers to, and I just want to make sure everybody gets information. Can you reread those questions and just kind of summarize your answer? That would be great.
Yeah, absolutely. So do you have any recommendations for situations where patients, families refuse interpreters and prefer families? I have encouraged providers to say it is their policy to utilize qualified interpreters for medical appointments, but just wondering if you have any other suggestions for these situations. So it's very common. And as a medical interpreter, I have encountered this, but also talking to Bethany, talking to folks at Division for Deaf and Hard of Hearing, they will prefer sometimes to have family members for various reasons, because they haven't had good experiences, because interpreters haven't been culturally proficient, or they feel that they haven't gotten a good interpretation. And we definitely have to start approaching this as a standard of practice and not as a best practice, because it is twofold. When we talked about that communication autonomy, we want to make sure that we're not only addressing the need for interpreters to access services, we also need the provider to access those same services. And that means that that interpreter is not only there for the interpreter, but it's also for the provider. And that interpreter is there because they are, one, they're mitigating liabilities. They're making sure that if, for example, in documentation, the provider is making sure that of checking off the boxes and making sure that an interpreter is there, by the time that hospital gets audited through Joint Commission or any of the other bodies that audit clinical settings, they will make sure that that area is covered. Also, if for some reason there is a miscommunication with the family member, we are also going to encounter a liability. If for some reason that patient ends up in the ED because medications were not taken correctly, that could be another outcome if a family member is part of that communication interaction. The other part is that interpreters have to follow, as Millie explained, very strict protocols. And that's why we emphasize so much the need for certification. Interpreters are there to be conduits, to be cultural liaisons, and to enforce impartiality. So the interpreter is not there to step in as the patient or step in as the provider. And family members sometimes can, through their own apprehensions or their own biases, they can interfere with that provider-patient interaction. The other question, and I saw someone who is a Haitian Creole interpreter, do get in touch with us. We want to, we know we have a big need in North Carolina for Haitian Creole interpreters, and we are constantly communicating with LSPs that are in our state term contract that could be in need of a Haitian Creole interpreter. Then the last question is, do you have suggestions on how to deal with situations where external providers like physical therapy, et cetera, in the community who refuse referrals because they do not have interpreters? And the response that I posted was ancillary services will tend to not have interpretation services. And that's currently a very big gap. So I saw your comment, Bethany. So ancillary services is all of the other accompanying services that are beyond the provider-patient interaction. That means radiology, when somebody needs to get an x-ray. Usually we will not see interpreters in those settings. However, those are settings that also need interpretation services. And it's so, to me, it's so crucial to think, for example, in an MRI, when individuals have to hold their breath, right? For the radiologist to get a clear image, to not compromise diagnosis of a cancer, for example. Those are situations that would require an interpreter to make sure that outcomes are accurate and that results are vetted through a process where language access is a critical component. What I would suggest in these types of scenarios is to remind the providers what are their responsibilities and what are some of the legal frameworks that protect individuals with limited English proficiency and ensure that those services are provided. So being able to tell them, hey, under Section 1557, you do receive through Medicaid, you do receive through commercial insurance, you receive funding indirectly. This means that you do have to comply. And in cases when they are still not being compliant, it is important to go up the chain and to change that. I had that experience with my parents with a physical therapist who did not have the capability to provide interpretation services and went through that process of being aggressive towards them. Like, why don't you have an interpreter? It's more of having that conversation of, did you know that you need to provide interpretation services? Their solution was even better. They got a bilingual physical therapist who could sit down and work with not only my parents, but with a highly diverse population in the area where they live. So it is important to have those conversations, to not be afraid to ask questions and to request different solutions.
Perfect. Thank you so much, Victoria. And I don't believe we have any other questions, but if you have one, now's your chance to throw it in the Q&A. Otherwise, I just want to thank everybody. This is just such a an amazing collection of knowledge in one place. And I just want to thank you guys so much for partnering with ECAC to bring this information to families, which is what you guys did last Saturday, and then to so many professionals today. So I will send out a follow-up email. It will probably be Monday, and it will include a link to the recording. It's going to include a certificate of attendance. And for those who are able to share their slides, it'll include a PDF of the slides. I also am going to include some resources that Millie posted in the chat. And then if any of the other presenters have any links to resources you guys want to share, email them to me. I will include those in the follow-up email. And again, that email, I'm going to have a goal of getting it out on Monday. So don't be surprised if you don't see it before then. So we do have, let's see, one more in the Q&A, just a great information, and gracias and thanks. Yes, thank you so much. Awesome. Okay. All right, everybody, will have a great rest of your day, and we hope to see you again sometime soon. Bye, everyone.
Bye-bye.
Gracias. Thank you. Bye-bye.